welcome. Senator Sheehy.
Thanks for coming today. Great to see you. Before we get to community care, health record transfer from active duty. Where are we on taking active duty service members who have a very finitely documented health care records when they are separating? There's no reason that once they separate, those health records should be thrown in the trash bin, and then they have to get a whole new physical examination done, not just for their disability claims, but then also for the VA to have their health care records on file. I think it's about time, instead of having them show up with a car and then taking that car apart and spending 6 months building them a new car, they're getting out of the DOD with clean health care records. They should be able to take that departure physical exam conducted by the DOD and have it seamlessly transferred to the VA as their induction physical with the VA to eliminate that leap of faith and that gap that so many veterans fall into as they're getting off active duty and being awaited to be ingested by the VA healthcare system for both disabilities as well as healthcare. So would like your comments on what the path forward for that could be.
Senator, I think, so number one, this is called the 0-day record issue. This is something that Secretary Collins and Secretary Hegseth are personally engaged on and have met. Deputy Secretary Lawrence is leading this for VA. I know that there was a meeting between Department of Veterans Affairs and Department of War on this issue yesterday. We are looking at how we do that and how those records automatically come over, and that this would be seamless to the service member who then becomes the veteran, but these records come on day one, or 0 day.
Yes, good. And as the CFO, you'll know that'll save you a lot of money that you can spend on other things instead of having to pay for another health exam to happen that's already happened before. You can direct your focus on providing the care needed. Community care, as has been referred to, has been the law for a long time. And the general assumption, in fact, I just left a meeting of Montana rural hospitals, is that in the opinion of a state like ours that has not just rural health care but frontier health care, that the VA has intentionally made itself a very hard customer to do business with as a payer. And for these hospitals, the number of hurdles they have to go through, both to qualify potential veteran patients to come in, and in a state where it could be the difference between a 30-minute drive and a 5-hour drive, having to wait weeks or months to get the care they need because they're waiting for authorizations is unacceptable. So how are you going to knock down those barriers that are blocking veterans from accessing community care, specifically in the very rural environments in places like Montana?
Senator, access to care should be seamless for the veteran, and particularly in a place like Montana where you've got very rural areas, where you've got rural care, where you've got the community providers who want to participate in the program. They want to be part of this. VA has made it difficult. We've made it difficult via the referral process, the eligibility process, authorizations, and then payment. The goal of this program is to make this program operate like the other payer programs. And virtually every single rural provider that maybe you've talked to and has been in your office is a Medicare provider. They treat Medicare patients. VA uses the Medicare fee schedule in this program. So it already looks like and pays like Medicare, but it doesn't operate like that. So to the extent that our processes and that our requirements match those, it makes it very easy for a provider to do business with us. And that allows the veteran to go down the street, whether it be a rural community, town over, whatever it may be, and access care. The goal of this program and our ability in this and how we manage this is to make this seamless. And even things like measuring quality, we spent a lot of time talking about that too. How VA is going to measure quality in this are industry standards. Everybody already does this who's providing care. It makes it easy and it makes it seamless to provide care for our veterans in this program.
And, a follow-up to any of you who care to jump in, but I think, when you look at that ease of access and pay, TRICARE and the DOD, no one's perfect, but they have a system that if you talk to most active duty or reserve members who have TRICARE or healthcare systems, they're like, listen, TRICARE is easy. I mean, it's seamless. And those members will tell you, yeah, this is pretty seamless. As an active duty guy who was married, my wife was active duty, we dealt with that for years. And it's frustrating that why is the VA also a federal agency that's obviously closely affiliated with the military as far as personnel? How come one can be so easy and the other doesn't? So I would just encourage you, let's not reinvent the wheel if we don't have to. There's systems that are in place that work that the federal government has been using for decades. If we don't have to build something from scratch, like we've been doing with the electronic health records for like 30 years, let's just use something that works already and put it to work, because the veterans are tired of waiting for community care to work for them. So thank you.